Why be a nurse? A doctor is so much better.
It's good to be a nurse because you get to give your patients good bedside care. In comparison to a doctor, they don't spend as much time with the patients as us nurses do. And that's the most rewarding part of nursing.
What is the point of a male nurse?
It is important in nursing to have male nurses. Not only we can prove that we can also care and be sensitive with the patients, but there's a lot of areas in nursing that require strength, where we actually pick up patients, we move them from beds to stretchers, and also certain people, they feel more comfortable when they have a male nurse.
What grade should I have to be a nurse?
It's very important to have good grades, especially in science. The least grade you can have would be a C, but preferably A or B will give you a better option of getting into a nursing program.
Is studying nursing hard?
Okay, studying nursing is hard. You do have to do a lot of reading. There's a lot of research papers you have to do. Also, not only do you have class, but you do have a clinical part. So it is very demanding. When you go to clinical, you have to know your material in order to do a good job with the patients.
Is doing your job as a nurse hard?
Working as a nurse, it is hard, but it is very rewarding as well. We work long hours, and we deal with people that are sick most of the time, and therefore they're not in their best comfort and as happy as the regular person would be. So it is challenging.
What roles as a nurse do you recommend for nursing students who just finished college?
Alright, for a new graduate nurse, I would recommend they start in the medical surgical unit, where you'll get to learn and firsthand everything you learn in nursing school, all your med-surg conditions, and especially you'll get familiar with the supplies we use in the hospital setting, documentation, and how to communicate with the other healthcare teams. That would be the first step that I would highly recommend for a new grad.
What would you say to someone if they're nervous about studying nursing?
Okay, if you're nervous about studying nursing, it's completely normal. Most of us feel some type of anxiety or are scared of things that we don't know. So this is a normal feeling. I would recommend you volunteer at some hospital or a nursing home where you'll get to see this firsthand, and it'll help you feel better and help you decide if this is something you like to do.
What do you recommend doing if a student is failing one of their nursing classes?
If you're failing one of your nursing classes, I recommend you speak to your teacher, and they can give you ideas on or some studying tips, and maybe they can help you get some support, get you in a study group. But definitely in nursing, you're gonna see several areas, and you may be better at some and do not as well in others. And the point is to find out what your weaknesses are and let somebody like your instructor know so they can help you improve in this area.
Is being a nurse worth it in the end?
Being a nurse is very, very rewarding. It's a great feeling to help a patient and have them say thank you, and sometimes give you a hug or find other ways to appreciate what you've done for them. Not only you see this from the patient itself, but the family members. Very seldom will somebody write a letter and let everybody else know how much they appreciate what you've done for them. So in the end, all you work hard for, it is very rewarding.
Any other advice would you give to anyone considering or studying to become a nurse?
One last advice: if you're considering nursing as a career, a second language will definitely help you a lot. It could be Spanish, it could be Chinese, depending which city or what type of population you'll be working with, you should consider that language. I would highly recommend that.